Thank you so much for joining us today. We are so happy to have you on board. Today's session is quite special because we have so many prominent speakers with us today. Oh, sorry, I did actually switch on my video here. Well, I'm nobody here because I think we are surrounded by fantastic professors and academics for today's session. Today, we're going to discuss about gender inequality, work-life reconciliation, and COVID-19. And with this current situation that's happening, there's so many issues that we could actually encompass about gender inequality. What does it mean? How does it work? And in this current crisis, we felt that this is a topic that we want to introduce as part of the Brunel for Business webinar series, Opportunities and Resilience in Crisis. Now, I do not want to take a lot of your time because I want to pass this session to our lovely colleague Didem. She will then be able to introduce you to the speakers and hopefully facilitate the session. And with that, I hope you're gonna enjoy the session. Now, before I pass it to Didem, I just want to let you know that feel free to put all of your questions in the Q&A function. With that, Didem.
Hello, everyone. So for today's session, we have lovely colleagues. Just to introduce myself really quickly, I am Dr. Didem Taser, here from Brunel. I'm a lecturer here, and I do research and I do teaching with HR and OB topics. We have Professor Shireen Kanji, a lovely colleague of mine from Brunel Business School. And we have Professor Mireia Las Heras, a lovely co-author of mine and colleague from Spain, ESC Business School, and also Professor Yasin Rofcanin, who's again professor from Bath Business School and a colleague and co-author of mine. Today, we're here for a very special topic. As you all know, COVID has impacted our lives in a huge way, but yet these impacts have not been the same for everyone. We know that from previous epidemics such as SARS, Ebola, H1N1, we know that all of these have shown that vulnerable people, vulnerable communities have been affected the most. And today we're going to talk about a very special group, women. We know that women have been hit by the pandemic quite disproportionately due to various reasons, such as them being workers, being frontline workers, being mostly working informal jobs, and doing a lot of sharing the heavy burden of domestic responsibilities. Before moving on, I would like to first set the scene for you a bit. Just to give you some, just set the scene, I just wanted to focus on 4 important pathways that how the COVID-19 affected gender equality outcomes. The first thing I wanted to just briefly mention is about the impact on health. We know that women have been working as frontline workers, and therefore they have a greater risk of exposure to the pandemic, both due to the caregiving roles, both inside and outside. Women are disproportionately exposed to COVID-19. And according to, for example, ILO figures, which I tried to put over there, 88% of personal care workers are women, and 69% of health professionals are again women. And for example, in Spain, we see that 72% of the care workers, infected care workers, were again women. That's one of the most important reasons. Again, another important factor is about health services. We see that health services are being stretched due to reasons related to women's reproductive health care, and these services are really critical in terms for them to keep on going. So we see that we see a lot of female morbidity in other pandemics due to this, so we see that this is a huge issue. Another field that we're going to discuss today, apparently I'm sure in more detail, is economic hardship. We see that women predominate service sectors and informal sectors. This article I took a screenshot from the New York Times. They call this a she session, and the reason is that women dominate service sectors, which have had the hardest hits. The same thing goes for the informal sector. Women work more in informal jobs, and again, they become more, have a huge impact, therefore. Another issue is the safety side. Unfortunately, we see a huge increase in domestic violence. UN numbers show that there has been a 25% of increase in domestic violence cases around the world. All countries are experiencing high numbers in terms of their helpline, so this is becoming a huge issue as well. And finally, what we're going to discuss today in more detail is impact on work. We see a substantial increase in the caregiving responsibilities for women, and in the previous old normal, we couldn't really find a solution for the work balance issue, and now with the new normal, everything is becoming even more difficult. And the worst case is that this is an invisible burden, so you can't really see it, and which makes everything more complicated. So not saying anything more, I want to finally share the floor to my wonderful colleague, Shireen Kanji.
Thank you very much, Didem. So I would like to talk about at least 3 different aspects of the crisis. And as Didem said, I think that we see this crisis, as in many other crises, that crisis really reveals underlying fragilities and frailties. And, particularly to pick up on the last point that you were talking about, Didem, about domestic violence, there is quite a lot of research showing that after disasters, rates of domestic violence go up, and we see that it's very difficult for women to report domestic violence, particularly in a situation of lockdown where there's very little opportunity to get out of the house, and where control is really exercised in an extreme way. But although that is of course a very important issue, but I'm going to look more at what goes on within opposite sex couple households. And we've seen that, in order to understand what goes on in the household, we really have to understand what's been going on in the workplace. And we see that there are 2 extremes for women. Some have had to continue working as key workers. We see that the sectors that women work in, 21% of women work in health and social care. So this is a really important sector for women. 85% of care workers are women. These people are still have still been going out to work. We've realized what a key worker is, or we started to realize what a key worker really is. But on the other hand, we've also seen that low earners are much more likely to work in a sector that was shut down, and women are more likely to be low earners. So examples of such work are childcare, non-food retail, accommodation and food. And so given these different positions, and also the women who are able to continue working, we see that there are very different outcomes for different women. And also within opposite sex couples, we see that there are likely to be very different outcomes. So the sectors affected by the crisis have differentially affected men and women. So if we look forward from the start of the crisis, from just before the crisis began to now, we see that mothers are more likely than fathers to have been furloughed. There's a 9 percentage point difference. Mothers are 9 percentage points less likely to be currently working on pay than fathers. So, in part, that is to do with whether the jobs permit you to work at home. But it isn't only about that. Even when we control for working at home, whether it's possible to do the job at home, we see that women seem to have been differentially affected. So if women are more affected by furlough, then of course they are more available for homework, for domestic work and for childcare. And a number of studies have already been run. Of course, we can't really rely on our usual data sources, big representative samples during the COVID crisis. A number of people have already run surveys, and Mireia was telling me about the survey that she and Yasin have been running. So some people have got off the ground very quickly and run surveys, and we are able to draw on those surveys in order to examine what has actually been happening. So, we've seen that mothers are more likely to be furloughed. That means that they are more available for this work at home. And but we do see differences. It makes quite a difference. If a woman is not working and is at home, she's doing a lot more childcare and housework than if a man is furloughed and is at home. We've seen for both, I'm sorry about this focus on opposite sex couples, but this is the focus of research that I'm undertaking. And so we know that actually women are more likely to be doing more domestic work, although both men and women are doing more domestic work under lockdown. So we've seen we can move to the next slide now. We've seen a really dramatic change actually in the extent of home working. So nearly half of all working adults work from home between the 11th and the 14th of June 2020. So before this session started, I was just having a look at the UK's longitudinal survey, Understanding Society. And, really a very, very small share of people reported exclusively working at home in the years coming up to this lockdown. It was really very small. Some people were working at home and working in the office at the same time, a larger proportion. But to go from around, 5%, and working at home was largely women's work. It was sort of work that was not of high quality, although that is perhaps beginning to change. So having a job that can be, now we see that having a job that can be conducted at home is a predictor of job retention, and more men than women report being able to work from home. But then even when they can work from home, then women have a higher probability of losing their job. We also see that in what's going on in couple dynamics, we see that actually a much higher proportion of women report anxiety. 61% of women report they're finding it harder to stay positive compared to 47% of men. And we see that actually women are much more likely to be involved in the kind of work that we call emotion work, where they are responsible for contacting other family members and for sort of making sure everyone is okay. So that seems to be taking a toll on women. This ties in very much with work I've been conducting with Hee-Jung Chung from the University of Kent and Anka Planyol from City University, where over the last year we've been developing a questionnaire which we've just run actually, looking at the mental load that women largely shoulder in households, where it isn't just about who does the jobs. It's not just about, who does the physical care of children, who prepares their meals, who reads to them. We find that both men and women are doing these activities more. Women are doing them disproportionately more, but both men and women are doing them more. But what we see is that actually the responsibility for those tasks is largely residing with women. And this adds a layer of stress, which I think ties in with these reports of anxiety. So we are seeing that there are probably changes that are occurring within households. If women have lost their jobs, they are more likely to be doing more housework. Both men and women are doing more housework and childcare. But previous research would lead us to expect that there will be long-term changes from these changes that have occurred. So I wanted to talk to you about, or tell you about, two studies that are perhaps from my perspective, are perhaps a positive story. These two papers look at the introduction of more generous paternal leave. The first one is in Quebec, where Quebec broke with the rules that were in force in the whole of Canada and introduced a more generous father leave. And with this more generous daddy quota, both in terms of pay and duration, they found that there was actually, the researchers found that there was an increased take-up of the daddy leave by fathers, and also mothers' participation in paid work also increased. And then we know that that's a real flashpoint for women after the birth of a child. So if they can keep in work, then that is something very positive. In the other study, which was conducted in Spain, looking at father's leave, the change in the availability and the generosity of father's leave had an interesting effects, because it first of all increased mothers' work participation, and the fathers who stayed at home were perhaps, put off having further children after experiencing what it might entail. I mean, there I'm of course filling in, but that was the effect, that they were reporting, less desire to have more children. So I wanted to tie in with some of my own research, because I think that this is a topic that is not really attended to when we're looking at connections within households and within families, actually, that grandparents, research I've conducted in the UK shows that grandparents, the availability of grandparent care raises mothers' labour force participation rates by 12 percentage points. That's for children of school age entry. This is an enormous effect, and really it's very under-attended to in the UK. I think people don't really think of the UK as a sort of country where families are so close, or perhaps researchers don't. Grandparents live close to grandchildren. Around 40% of school-age children live within 15 minutes journey time of their grandparents. And grandparents provide care on a regular basis for 36% of children in lone mother households and 32% of children in two-parent households. So the lockdown has had this effect where most forms of childcare have dried up during the lockdown. Parents are at home just trying to cope with childcare and work. I think maybe a lot of workplaces don't really recognise how difficult it is to combine the care of young children with working. But parents don't have any childcare now, and they can't even turn to the grandparents who are providing a lot of that care in the UK today. So I think that I just wanted to wrap up there. And really what I think was important is that, that there are many effects on business of what happens within the family. The family is very intimately connected with what happens in the productive, in the paid work sphere of the economy. So thank you.
Thank you very much, Shireen. Now I'll just stop my screen sharing and I will leave the floor to Mireia, who will be discussing her research on the gender effects of COVID-19.
So first of all, thank you all for joining, but very especially Didem for organizing. And this is almost a birthday party because tomorrow is the birthday of my friend Yasin. So we decided that this was going to be the perfect party for all of us. So that was a very good thing to do. So as Shireen kindly mentioned, we've been witnessing what was happening, in other countries with the COVID, and so we thought it would make sense to be ready in case that would happen in Spain, so that we could use this, let's say, global experiment, that was already, happening in Italy and before in Asia and so on and so forth. So we were very much ready when it happened in Spain. So basically, when we had the lockdown on March 16th, we were able to launch our daily diary study. And basically our interest was, before we had done some research on telecommuting, but we were very much aware that this was not going to be regular telecommuting where you stay at home, enjoy your Wi-Fi for yourself, you have the whole house, everything is silent, and you can really, make very good use of the day to be very productive and even to relax. So on the opposite side, we were thinking, this is going to be a very tough time, and we need to focus on what are going to be the conditions of that effective and efficient work. And honestly, in the beginning, we didn't think of focusing on gender perspective. That came later as we started looking at our results and seeing that what we were studying was very much affected by gender, by gender. So depending on, but very close to what Shireen was mentioning, one very relevant thing was about mental home demand. So, and that is going to come later in my exposition. Sorry, I didn't prepare slides as nice as Shireen. I just like prepared my talk without my slides. And so basically what the results I'm presenting today belong to two studies. One of them went, as I said, from the first day of lockdown in Spain, that was March 16th, to March 29th, that is 10 days of work. And then the second study goes from May 19th to May 30th. And each of these studies includes around 750 people, and they were invited to participate every single day. So on average, people participated around 6 days in the survey. So we have around 500 responses, which means 7,500 responses, which means those refer each one to 1 day. And most of our people are from Spain, Mexico, Guatemala, and Chile, which means that we cover very much Ibero-America, so all the Spanish-speaking areas of the world as of now, right? So, and this is not, it's a little bit by design, and also a little bit, because that was what we were able to do in such a short time. So, first of all, I want to say something that it goes very much aligned with what Shireen was mentioning, but, adds a different layer somehow, and is that what we found is a story not only about gender, but also a story about motherhood. So basically, we focus on interference, work to family, family to work. We focus on mental fatigue and stress, on vitality, and engagement at work and at home. And what we see is that for men and women who are not in stable couples and who do not have children, there is no difference in those results. So basically, it's like you are a male, you are a female, you are alone at home. There is no one else in the household. You don't have children, and we find then that there is no difference for males and females who are in that situation. So, which means, and this might be, just like making an inference, which means that this is not something that is genetic, or that's something that is basically something that is based on roles and on expectations for men and women, because we don't see any kind of difference when we have, for that group of males and females who are at home by themselves, not surrounded by anyone else, and with no children. But then, the story changes very, very much when we start looking at males and females who have children, and also males and females who have parents at home. Then there we see a big difference. So basically, to start with interference, work to family and family to work. Interference means, that those unsolicited interferences, those unsolicited calls or emails or messages in any kind that arrive either when you are at working. Now, of course, you're working from home, but you are working and your family requires you to do something or calls you to do something. And I'm sure that all of us could share, hundreds of experiences and of anecdotes. Just a few days ago, I was with my colleague professors having a meeting, and the only female in my department, she said she all of a sudden did a very strange gesture. They said, "Oh, I'm listening something very strange in the dining room." So she went and never came back, and then sent a message saying that she had spent the afternoon in the hospital, right? So definitely those kind of things are what is interference, family to work and work to family. So again, so there we don't see any difference when males and females are, not in a couple, not having a partnership, and they do not have children. Yet, women have, we find, 9% more interference from work to family than males do. Women who have children have 9% more interference from work to family. But that is double, so 20% more interferences from family to work. So basically, when children are at home and mom and dad are working there and they doing, the remote work, if they need something, if they just want to get, something, they go more to the mom than they do go to the father. So that results in women having, or mothers having, 20% more interferences from family to work than the opposite. That gets to be way much acute, severe, when those are mothers with no partners. So in comparison of mothers with no partners and fathers with no partners, of course, here we probably have an effect that fathers with no partners might not have the children at home. But for those people who they report being single mothers, they even have a 15% higher rate of interference from family to work. So basically, as Shireen was mentioning, that is a huge mental demand, that is a huge emotional demand, because you need to respond and to be responsible for those people as you're working. So that also means, as we will see, that that creates more fatigue and that creates more difficulties to work. So what can alleviate this situation? So there are two things that we find that alleviate this situation. One is when the mother, when this woman who is working with children at home, have a partner. If she has a partner who is supportive of her work, then we find that this alleviates in to quite an extent the situation. So this is very, very interesting, because in the literature, there is a huge literature that talks about family supportive supervisor behavior. And here what we're interested is not on family supportive supervisor behavior, but on a spouse work supportive behavior. So it's the other direction. So it's not, the supervisor supporting the home, but the spouse or the partner supporting the work of her partner. So and we find that this actually alleviates the situation to quite an extent, making it easier, or at least making that difference to be much smaller between fathers and mothers. Then again, Yasin is going to be talking a little more about outcomes, but we have mental fatigue and stress, and we see again that there is no difference between female with no children and no couples, no partners, and males with no couples and no children. So there is no difference in fatigue, and there is no difference in stress. And but that is very different, when we look at the average of all women and the average of all men, because that does include all men and female, who have spouses but also have children or are dependents. And then we see that in average, women have 20% more fatigue, the mental fatigue, than male do, and that's especially more acute for mothers who are alone, who do not have a partner. And so on the opposite, the women who are more similar to the males are the females who have a partner, even if they don't have children, So those are much more similar to the men, who also do not have children. And then also female have a higher level of stress. So, I mean, that's not surprise, right? Because if they have more mental fatigue, of course, or obviously they will also have more mental stress. But what can alleviate these situations? So again, if the spouse or the partner shows to have a high degree of sensibility and of support toward work of the partner, then those female will have a much lower extent of mental fatigue and of stress. But it's not only about what the partners do, but it's also about what leaders do. So the leaders who show to be, family supportive also make females to have or to show lower levels of fatigue and stress. And then, so it's about the spouse, it's about the leader, and it's also about how women, trust themselves and actually feel they are competent to overcome those situations. So actually, a high level of esteem makes women to have lower levels of mental fatigue and of stress. So all in all, basically, what we are finding is that both males and females, if they are alone, if they don't have a couple, if they don't have a spouse and they don't have children, then they show very, very similar levels of stress, of fatigue, of mental home demands. But that gets unbalanced once the female is married or is in a stable couple, especially if she has children, and especially even more if she has to care for the elder. And what alleviates those situations is the support of the spouse, the support of the leader, and also the esteem of the person and the trust that she has on herself. And with that, I'm gonna pass it on to Yasin, who is eager to also share about the consequences. So thank you very much.
Hello, everybody. Apologies again for being late for 10 minutes. It was a technical issue, so it was an issue about emails. But for those of you who know me, I'm always a little bit late for this kind of event. So 5 minutes was actually put in advance for me not to be late, but I managed to be late for extra 10 minutes. So apologies for that. So thank you, Shireen, thank you, Didem, thank you, Ainur, and thank you, Seb, for all the helps and all the encouragement and for organizing this amazing platform. It's really an honor and pleasure to participate in this event, as I recently started to deep dive into the impact of certain psychological mechanisms and affective events like stress-related events or positivity-related events such as COVID, although it's not evoking positive emotions, but mainly evoking stress, and how it impacts on gender differently. So thank you for organizing this event, and it's actually very interesting for me also to listen to the findings of Shireen in addition to the findings that we've had recently with my co-author Mireia. So today I will talk in more detail about the impact of COVID on the psychological well-being and stress-related outcomes of our participants. And I will talk you through about the two studies that we have conducted during the early stages and the late stages of COVID, and then unpack the details and the nuances of what happens to the well-being and the stress level of employees, to their important outcomes relating to family and work. And as Mireia has kindly shared and provided detailed explanation, all of the propositions and the associations that I will talk about will be more salient and will be more significant for women. So although Mireia talked about the importance of our relationships for different genders, especially women are the main victims of COVID, bear in mind that all the associations and the findings that I will share with you, again, will be more negative, will be more salient and important for women. So that's a significant finding that we have found. And very early in the morning, I've actually managed to submit this paper to Journal of Occupational Health Psychology, because I'm very proud of the findings that we have. And we even named the paper as "What Happens at Home Stays at Home, the Real Victims of COVID and the Dynamics of Work Family." So the main question that we have been tackling in these two data sets is, how does COVID shape our well-being? And in trying to understand the impact of COVID for our well-being, we come to main and major nuances in terms of gender, in terms of mental home demand, in terms of love for spouse, in terms of the supervisor support for people working from home. But these have been discussed by my co-author and great friend Mireia And now I'll talk you through about the well-being outcomes. And in the first study, we have explored the role of workflow and the impact on two employee outcomes, mainly work intensification and sleep quality. So work intensification is something I think all of us have felt the pressure for, that more and more nowadays, especially during the peak times of COVID, we have felt that we have been working much harder and we were putting in much more effort and to become productive, maybe to become more efficient or effective. In other words, or maybe that was personal for me, that I felt like my work has become more intensified. Although I was working from home and I had the freedom to work wherever and whenever I want to, I found out myself, and most of my colleagues and friends have revealed the same findings, that our usual work tasks have become much more pressuring and much more intensified. Not in the sense of them being so pressured, but we've just perceived them to be more intensified. Similarly, and again, that was based on some anecdotal evidence with my friends and colleagues, people were not following their usual sleep patterns. So sleep patterns changed, and friends and colleagues were reporting either excessive sleep or lower extent of sleep. So in the first study, our aim, one of the goals of our aim was to understand the daily fluctuations. In other words, the within-person variance or dynamic nature of how COVID every day in its peak time and in its early stage when the lockdown was pronounced and announced in the Spanish-speaking regions of the world impacted on our two key outcomes, namely work intensification and sleep quality. So to cut the long story short, what we have found was, of course, COVID impacted on our sleep quality and work intensification negatively. That we reported lower quality sleep. And also we perceived our jobs and tasks to be much more intensified and much more pressuring. But what explained that finding was the lack of workflow that we have at daily for our tasks and for our jobs. In other words, we didn't feel the dedication, we haven't, I shouldn't say we didn't, but we haven't felt the dedication, or we haven't felt the vigor and the sense of excitement for our jobs that we used to feel before COVID. In other words, boredom and alienation from our tasks were the main reason explaining why COVID actually led to a higher feeling of work intensification and lower quality of sleep. So that first study again was instrumental in introducing workflow. So what COVID did for us work-wise and when we were working from home was that it interrupted the sense of flow that we have about our tasks and about our jobs, and that we haven't felt in the moment. We haven't felt the Zoom. We haven't felt in the moments to sit down, to write, to have effective meetings, or in other words, maybe we were trying to do so many things at the same time that we actually lost track of what was important and what was not important for our daily tasks and daily work issues and work goals. So the first study concluded that workflow was missing, and because of this, COVID-19 had its undesirable and unfavorable impact on work intensification and sleep quality. And to mention again, this whole relationships, if we can pass on the second slide, Didem. Again, this was the conceptual model of the first study. And again, as I said, this whole relationship was more significant, negative, and unfavorable for women. So women who were, 50% of our participants were women, and they reported significantly less extent of workflow and significantly higher extent of work intensification and interrupted sleep quality. And as Mireia said, this was mainly due to various reasons of being single, alone, having to take care of the children alone, and the inertia and the structural obstacles that are already there in order to, that gives different gender, women and men equally, different access to different work opportunities. There might be different reasons, but what our findings in the first study spoke to the fact that we didn't feel that our work was flowing, that we were in the moment about our tasks, and as a result, we reported undesirable employee outcomes, which connected us to our second study. And the second study was conducted then later on in the later stages of COVID, when things were a bit easier. So that was around the last week of April towards the first week of May. So in this study, then so our focal construct was again stress related to COVID. So we wanted to understand, so we knew that people were reporting stress, and that was mainly related to COVID. And we wanted to then in this study understand then what can prevent people from losing their resources and from, as a result, being more effective, productive, and engaged in their family. In this study, therefore, we introduced two important mediating mechanisms, resource accumulation and work-family interactions, as two mechanisms that, that follow COVID and that explain the impact of vitality. So vitality here, in addition to sleep quality and work intensification, was our final outcome, because vitality is a sense of feeling engaged towards your job, that you are part of your job and that you feel positive, energetic, and eager to go above and beyond what is required from your task. So as you can see, in this model, we are explaining and trying to understand the daily fluctuations of what COVID has done to us in those later stages of the lockdown. And what I can tell you briefly is, and again, this study unpacked the reasons furthermore and in nuanced details, that it depleted our resources. So resource accumulation, according to resource theories, is an important mechanism, is an important account that explains why the acquisition of certain resources lead us to perform better, lead us to be more engaged, or lead us to be engaged with our families. So in this study, we noticed that people reported depleted resources. So they felt that they were lacking focus, energy, support from their loved ones, and support from the supervisors, all of which culminated into the concept of resource accumulation. In other words, the lack of resource accumulation. And people who reported lack of resource accumulation then reported higher extent of interruptions. So what are those interruptions? Interruptions, because we are all working from home, these are the interruptions in which work and family boundaries have become too blurred that we cannot manage the boundaries. And here on that relationship, as I think Didem has been thinking and working on that topic, it is segmentation preferences. And in that relationship, segmentation preferences of employees come into the scene as becoming, or as being, a very important factor. But what I can tell you is that COVID led to depletion of resources, and as a result of depleted resources, men and women, but that was more significant for women, they felt like they were not able to manage the boundaries between work and family. In other words, family was interrupting to work, and work was interrupting with family. And both directions of relationship were significant and negative, and women reported higher levels of interruptions. And that's another topic, but that we discussed this with the role expectations and gender norms, but that's another topic. But what I would like to tell you is the reason why COVID actually led to reduced vitality, in other words, sense of engagement. And that is because every day when we report, or when we think about, or when we ruminate about COVID, we build up stress. And we know from the resource theories that stress reduces our limited personal resources like focus, resilience, energy, attention. And we measured that for the first time as a contribution to literature. And that actually intensified the interactions that we are experiencing every day at home, about work, and about home. So we are home, we are confined to our homes, but every day we are reporting a higher extent of interaction. And I'm not referring to conflict, because conflict is something else, but that is rather an interruption. So interruption can be something manageable for certain people, or it can be something conflict creating for other people. So the long story short, the second study was aimed at understanding, unpacking, unearthing the more nuanced details of what happens after we report stress related to COVID. And in addition to the findings of the first study, where we found that workflow was reducing, here we found that workflow and resource accumulation are very much related to each other, that we are actually losing our resources. And these resources are intangible resources. And as a result of this, we don't have the capacity and we don't have the endowed resources to further deal with the various problems that work and family impose on us when we are working from home. And as a result of this, it is natural, only natural, that we report a lower extent of vitality and lower extent of engagement towards our jobs and towards our tasks. And as I have emphasized, the novelty of our findings, I think, is again gender, that all of those relationships, irrespective of the first study and the second study, they have become significant, salient, and important for women. and women were able to suppress or deal with those demands when they received support from their supervisors and when they were feeling that they were loved by their spouses. So as an antidote to what can be done in order to help us, men and women, and mainly women, is to ensure that there is support mechanism, relational support mechanisms at home. And this could only be our significant others, our partners and families and loved ones. And at work, this could only be our supervisors. So when we see signs of support from our supervisor, and that can be formal and informal, women are able to maneuver and tackle the pressuring demands arising from their work within the home domain. And when they report that they are supported by their spouses and by their partners, again, they are able to report lower extent of undesirable employee outcomes. When I tell the story, I think it's not surprising, given that we have been exposed to the news about COVID all the time, but I think most of the evidence in the newspapers and everywhere have been anecdotal, or they have been descriptive studies. So this is very important and a very key study for me and for my colleague and friend Mireia, in that I think it's the first study to actually show that women are the main victims of this COVID, and it doesn't change. Either it's the early stage, the middle stage, and the late stages of lockdown. Now we are in our later stages of the third study, where we are looking at the conditions under normal circumstances and whether the same patterns with different variables and construct will emerge or not. But the bottom line is we lose our resources. We have lost our resources, and we have lost or forget about the sense of flow that we have been pursuing or holding towards our tasks. And as a result of those, we report high extent of interactions in respective to family domain, and we have been reporting, or we have reported, lower quality of sleep and intensified work pressures as a result of the loss of workflow and resources that we have depleted, emanating from the stress related to COVID. Happy to share with you the full findings and executive report, but that's all I wanted to share with you for today, as it's a very important study that we were able to conduct in the very difficult times of COVID. And thanks to Mireia, who with all her network and efforts were able to manage and recruit people from all around the world. I think we were able to come up with these striking and I think very socially important results. Thank you very much.
Thank you very much. I would like to thank all of you for your very interesting work and insights you have provided as well. Now I would like to move on with the questions. We have quite a few, so that's really good. But I want to start off with something I was really thinking about, and I think it's some of the central themes that come up from the question as well. And basically, with COVID happening, do you think work-life balance is becoming a myth? I mean, can we still think about work and home time as separate blocks, or how will work-life reconciliation look in the age after COVID-19? I would like to ask all three of you. So Shireen, would you like to start?
Well, I think that work-life integration, is something that is nice in theory. But when you want to actually do any work, I think that perhaps it's necessary to have some separation. I mean, I was looking at the children's time. I mean, there's a question there, which I think is a very important one, about women who don't have children. And I think that Mireia did have some really interesting findings in relation to women without children. So I think we should come back to that. But about the work-life integration, I think that actually care, women have always tried, haven't they, to accommodate work and care together. That's why they've been more likely to be home workers. Quite a lot of women have transitioned to being self-employed as a result of having children. So they've tried this work-life integration, but I don't really think that you can have, the work is to some extent compromised by this work-life integration. So I think that we do need some barriers, and that's why we see that it's actually very difficult. If you're sitting here, if you're sitting at home on your own, you've got, some distractions, but it's quite easy to get on with your work. If you've got, two small children, very difficult. So I would say you can only go so far.
Yeah, absolutely. Do any of you want to have any other comments, or shall we move on with the next question?
Yeah, I want to comment just a little bit on that because I think it's a very, very relevant topic. And I would say that, first of all, I don't like the term, even though I use it all the time, the term balance, because it seems that it has to be, you know, the same weight, you know, so, and I don't think that, that is the case, you know, so, and I don't think also that probably balance means that, you know, because it depends on whether you are, you know, married with children, unmarried with children, you care for your parents, you have a disabled person at home, you are, you know, and you have a special need for health issue, whatever, right? So I think that balance might not be capturing. So I turn to like more integration, but not integration in the sense of having both work and non-work, work and family at the same time, at the same place. I like to think about integration more like as a puzzle that, you know, actually fits together and, you know, gets to draw a nice picture. But, you know, that there are those boundaries that Shireen was mentioning, because I think boundaries are very important. And part of what we are finding in our research, and you know very well, Didem, is that people have different preferences for boundaries. So some of us, you know, like having very, very strict boundaries. You know, when I'm here, I only do work and I forget who I am, you know, so I forget I'm a mother, a father, an auntie, whatever, right? So I'm just an employee who is doing her best, you know, and when I'm at home, I completely forget about being an employee. I'm only a mother, a father, you know, a citizen, whatever, right? So and I'm there just like focusing on, and there are people who have those clear and very strict preferences for boundaries. And I think probably that has something to do with, you know, culture, background, experiences, or even genetics. I don't know, right? But what I know is that those preferences exist. And when people have a strict or very clear preference for segmentation, when they have both things together, they tend to really freak out, you know, so, and it's very, very negative for them. And so I think, can we achieve integration? I would say we can achieve a better integration that we used to have and a better integration that we have now, you know, because we are still in a very, you know, tough moment. But not an integration that means that we have everything at the same time in the same place. An integration that looks much more like a puzzle where, you know, the pieces fit together, even though, you know, they show their boundaries clearly and each one keeps its own space in the picture. So something like that.
Right. Perfect.
And just to add, just to chip in one sentence as to what Mireia and Shireen said, so I can talk about our findings very briefly, that as both of you have said. So in our findings, we've also measured the preference of people in terms of segmentation and integration. And integration means when people, as Mireia said, would like to combine work and family. So what we have seen was mean values for women was much higher, something, you know, that we've been accustomed to from society. But as again, we know that women are much better maybe at reporting that they are integrating. And that integration maybe comes from the responsibility they have about their children, about their family members, about their parents. But the striking finding is that segmentation preference didn't have a clear and consistent pattern in the findings, both in the early stages of, both in the study 1 and in study 2. So that tells us something. It's a very nuanced and complicated picture, that it didn't matter whether people have a preference for segmentation or integration. They reported, again, lower extent of workflow or lower extent of resource accumulation. Something to think about.
Right. Great. Thank you very much. So I want to go discuss some of the questions that our participants have provided us with us. So I'm scrolling in a bit because I'm trying to make most of our time. So Jennifer has a question, and which kind of picks up to Shireen's point there, that when we talk about women, we usually talk about women and we kind of integrate that with children. However, she's quite interested about our thoughts about women who don't have children. And we know that, you know, there are a lot of single people in the population. So, and she just want to pick up your thoughts thoughts on that. So when we talk about work-life reconciliation, what's your thought about integration of women? Are there any studies about women without children but have other responsibilities, and how they're affected by the pandemic or other work stress situations? Does anyone want to go first?
Well, I think what I knew I've already reported, that is in our database. What we find is that it's not only a gender issue, but it's also a caregiving issue. So basically, it's like for males and females, you know, who have no children and no caregiving responsibilities, there is not significant differences with men of that same. But that those differences appear very, I would say, appear not only when they have children, but when they have partners. I mean, so as I said all the time, you know, females with no partners or no children, but as soon as they get partners, they start chipping in more than their partners do. So then we see those differences already, you know, for women who have partners, even if they do not have children or parents or other people they care for. So that's, and I think it's an interesting topic, but as I said, also it shows that it's not a matter of like, you know, women not being so capable of doing, you know, things, or, you know, coping with the stress or coping with these difficulties, or even coping with technology as of now. It's more, you know, that women having more demands coming from, you know, so many varied you know, dimensions, that, you know, of course, you know, you have as many resources, you know, so if you spend them on something, you might generate some more, but not so much as to being able to cope with everything.
Right.
Yeah.
Yeah, I think it also, there's a sort of life course perspective on this, isn't there?
Absolutely.
That actually younger women, I think the gender pay gap, if you look at younger people, is not, you know, there's not really a gender pay gap, but it starts opening out. And we also see that reflected in organizations, that as you get older and as progression starts to become more important, that women actually fall behind. And of course, it's, you know, it's not just about whether you have care responsibilities. It's very much about how your status is interpreted at the workplace. So we know that men, you know, heterosexual men who have children, you know, they are revealing their sort of potency, heterosexual potency, and they, you know, they get rewarded for it. So, you know, these, I think there's a lot of, we have to look at what these different statuses, how they are interpreted in workplaces. I think that's also important.
Absolutely.
Absolutely. And there's one point that I would like to make, combining both of your points, is the attribution error that I read recently in some studies. When managers make attributions to the use of flexible work practices for women and men, and that's unfortunately a very striking and interesting finding, that when men ask for flexible work practices, the manager immediately attributes this to the aim of being more productive, so productivity motive. And when it was for women, that attribution is more family motivation. Well, there's nothing wrong with family motivation and with taking care of children and kids, like all of us like that. But then the striking finding is that managers then evaluate the performance of those less favorably compared to people who are productivity and who are supposedly productivity and work oriented compared to being family oriented. So that study I've always found very interesting in terms of the attribution error managers make for the motives of people.
Absolutely, there's a huge bias that's going on about women's performance, and if a woman wants to work flexibly, that's considered as a huge issue. And we
You're right.
a lot.
You're right. Your dissertation speaks to that quite a lot, actually.
Yes, exactly. So some of the questions that come up really tie about how to move on forward. So how can we make lives of women easier? How can organizations make women's life easier? And also men, obviously, and how can businesses, both small, medium, and large, support women? So I just want to pick up your thoughts on that. Who would like to start first? How can we mitigate, or how can we support women in the workplace, especially after the COVID-19 situation? Mireia, would
Okay,
you
so yeah, let me go first because it's the easiest to go first. So anyway, so at least on what we've been focusing on our studies, we find that there are these three main sources of support that we can draw on. One is on your supervisors. So, and especially we find that emotional support. So your supervisor asking you, how are you doing?
Mm-hmm.
Can I help you? Do you need anything? So it's not, about providing for expensive resources. It's just, caring and looking at you in the eye, even if through a screen, and asking you whether you need something and everything at home is okay or not, right? So one is supervisor support. Second thing is partners support for work. So it's not only about resources at work supporting home, but also resources at home supporting work, So it's basically about your partner also being aware of you being a professional and being a worker. And so, being willing to take a share and help you or help, the family setting. And third thing is about personal resources, just like having self-esteem and confidence that you can, get on and all right. So I think it's those three different layers. So it's the company, is your environment, especially your partner, and it's about you yourself. So
Absolutely. We always talk about organizations, but women's agency is really important here. And thanks for stressing that out. Thank you. Shireen, would you like to add anything?
Yeah, I think perhaps I don't really have that much to add on what organizations can do. But if I think about the women who are really vulnerable now, we can see that many women on really low wages, have lost their jobs, and they are really vulnerable.
Yeah.
And so, I think just in the way that policy is targeting particular groups of people, I think that those women who are not really going to recover their jobs quickly and who probably have limited resources to draw on, they need particular help. I think in terms of organizations, we see that women are being furloughed more than men. So, I think this also requires organizations to be accountable for, who they're furloughing, and to make this perhaps more explicit, the rules on who's going to be furloughed. There needs to be more explicit communication on that.
Absolutely. That also picks on to one of the earlier questions about what jobs are going to look like, especially those jobs that are more likely to be unemployed, and the importance of the organization, the importance of that organization to be monitored is very important. So absolutely.
So can I add a few things, Didem?
Yeah.
So in addition to what Mireia and Shireen have said, I think it's also nice to focus on an area we call leisure. So something between work and family. And that's especially small and medium-sized enterprises and companies can really capitalize on that. So we know the term crafting. Crafting is when you give your employees the opportunity to shape their work, but they can do the same for their family. So that can be family crafting. So they can be proactive and they can engage in a lot of chores and errands in their home domain to make their home life interesting and fun. And that doesn't mean that they have to have a family. That can be their housemate, or that can be somebody important to them. We refer to this as home crafting. So having story nights, walking out together, or drawing together. But then there's also the concept of leisure crafting. Leisure crafting, encouraging as an organization, as a manager, officially, and by giving rewards to your employees that there is leisure and that you may switch off from your work during weekends or any time that you take as off from your times by engaging in those activities. Because from research, we know that recovery and switch off thumbs up increases radically and significantly after you engage in activities that give you energy. And we refer to this, or informally, that this is leisure. And leisure crafting, again, can be an intervention, can be a training program by organizations to actively encourage their employees to spend time, to allocate time for this. So in addition to what's been mentioned very nicely, I can say that organizations, especially SMEs, can start focusing on and allocating their resources to the concept of crafting in the family domain and in the leisure domain.
Absolutely, absolutely. Thank you very much. I'm just trying to be mindful of the time here. So we're actually 40 minutes past our time. It was a pleasure meeting all of you here, and I'd like to apologize for the initial technical problems we had, but I guess this is the part of our new normal now, isn't it? Thank you so much for being here. Thank you for participating, and thank you for your wonderful insights that you shared with us today. And yeah, we hope to see you soon in another webinar here in Brunel. Thank you so much.